I love fat. I think fat is liquid gold. I love the saying of borrowing fat where you don't want it and putting it where you do. And so this applies to breasts as well. Fat grafting has been used in the world for a very long time. I think in the US we were late adopters, and that was because of safety. And so what we wanted to make sure is that fat was not going to induce a cancer, particularly in a cancer-prone region. So now that we've evened that out and know that fat is safe to transfer anywhere in the body, we're using it a lot for breasts. It will not replace breast implants. I think you can get maybe a cup size difference. You know, in Texas where everything's bigger, traditionally a cup's not gonna cut it. Where I think it's a great adjunct is contour. So our breast cancer patients, where we just need to add extra contour around a flap or even an implant, I think it's perfect for rounding out a breast. I think that it also works great for very thin women who have some visibility or palpability of an implant, so it's a little more natural of a feel and look. When we fat graft a breast, we want to make sure that all the fat we transferred has the best chance of survival. The way that it lives is by establishing a blood supply where we put it. So if you put a big old glob of fat in one area, the center of that's going to die because it's nowhere near a blood supply. Fat grafting is very technique dependent. And this is not something you go to the med spa for. Every board certified plastic surgeon is trained in the proper technique of harvesting and injecting fat.